My name's Steve. I turned 39 this year, that's 2012, and I had suffered a variety of health problems for probably most of my adult life. Never really thought that they might all be related. At the start of this year, that was prescribed by the doctor. And I really wasn't keen on taking them because I'd had an intestinal candida infection years ago, which gives really nasty cough. I'd been symptom-free for maybe 5 years, could eat what I want, no supplements. It came back within 2 days of starting antibiotics, so I woke up with like a hangover headache, bloodshot eyes. Once I would start eating carbohydrate foods, I'd get a nasty reaction because the candida is a yeast, and it gets out of control and it ferments carbohydrates, and so you end up with headaches and bloodshot eyes and essentially a lot of carbohydrate intolerance, so you end up on a very restricted diet. So I sort of shifted my diet to low carbohydrate foods, antifungal herbs and probiotics, which is how I got rid of it before, but it's a really hard battle. Now, I'm a software analyst by trade, so I tend to analyse a lot of information, assimilate a lot of information, throw out what's irrelevant and use what's relevant. And so I started to do research online because I thought, well, hang on, 2 days of an antibiotic, I know antibiotics are not good, but 2 days of a low dose shouldn't normally just wipe out the good bacteria in the gut so easily. So I figured there was an underlying problem, and I kept coming across people who'd had candida infections after a course of antibiotics or something similar, some drug treatment, and they said they couldn't get rid of it until they'd had their dental amalgams removed. So I started to research that, and I found that dental amalgam are what's otherwise known as silver fillings. They are, generally speaking, 50% mercury. Mercury is the second most toxic element to the human body on the planet that I'm aware of. Why anyone would want to embed that in someone's mouth for life is completely beyond me, but that was something that I'd have done when I was a kid. So when I was a kid, growing up in the 70s and 80s, you eat a lot of sweets because the television tells you to eat a lot of sweets. You get holes in your teeth, you get pain, you go see the dentist, you trust the dentist puts dental amalgam in your mouth. So I think I'd had about 8 or so done when I was quite young. And then I don't think I had any further after any more of those done after I went off to university, but I did have health problems as an adult. Now, I started to get a bit clued up around, after leaving university. I thought, maybe mercury fillings are not that good. So I figured if they broke, I would just have them replaced with white fillings, and that's what I did. Unfortunately, it's not as straightforward as that. Once you've got the dental amalgam in the tooth, if it's not cleared out completely, then there's, as I understand it, there's still potential for mercury to leach into the system. So the symptoms that I'd had for quite a few years were a variety of symptoms. Some of them consistently, some of them were more sort of on and off. But I guess the key ones that I was eventually able to link to mercury toxicity would have been bouts of insomnia, anxiety, some level of fatigue during my waking hours, the digestive problems, which was the problems with candida, and symptoms of hypothyroidism. So I would increasingly have cold hands and feet, low metabolic rate, and just feeling generally unwell. And as these symptoms go on over a period of time, you think, well, gosh, this is what it's like to get old, and I must just be getting old. As I started to put them together, I started to figure, no, I'm not just getting old, I'm just getting poisoned by mercury, and it's collecting in different body parts, different organs, and that's the conclusion I came to. So I looked for ways that people had dealt with this, ended up coming to see Dr El-Essawy because he'd already put on the web some YouTube videos of former patients and current patients who'd been through treatment to have dental amalgam safely removed from the mouth and to go through a detox, and they seem to have miraculous recovery from various symptoms of mercury poisoning. So I came in for a test. I had a vapor test done in my mouth. The initial test was quite high. I think it was 250 micrograms per cubic litre, per cubic metre even, of mercury in my mouth, which, as far as I'm aware, is a number of times higher than is allowed in any workplace where people work with mercury. And I thought, well, gosh, I'm swallowing this, I'm breathing this, it's with me all the time, 24/7. When I chew, it's increasing, which was pretty scary. So I felt quite agitated and quite eager to get this stuff out of my mouth safely. I think there was some more readings that were done, and it was off the scale that the vapor meter, I think, reads up to 999 micrograms, and it couldn't read any higher. So I went home quite anxious to get get the fillings out. I came in a week or two later. I was put to sleep, had 8 dental amalgams removed, and then a friend took me home to just stay over at his to sleep it off. Within 24 hours, I already noticed a difference in my symptoms. So I was more relaxed, I was able to sleep better, I could start to tolerate carbohydrate foods, my body temperature started to go up, I started to feel more positive. It's now 2 weeks on, a little over 2 weeks on. I'd say my symptoms are maybe 80 to 90% improved. I still have some symptoms, but as I understand it, it takes some time to clear the body of toxicity. But it's been such a significant improvement that I'm pretty much convinced that, you know, I was poisoned, and the primary source of the poisoning was what had been put into my mouth.